Okay, thank you everyone for joining today. This is the fourth and last in our series of webinars linked to the Handbook on Social Participation for UHC. For those of you who have not heard about the Handbook on Social Participation on UHC, we invite you to listen to the recordings of 3 webinars that we did a month ago, one in English, one in French, and one in Spanish. They're on the Health Systems Governance Collaborative website, which present an overview of the handbook project. My name is Deepa Rajan. I'm a Health Systems Advisor in the Department for Health Systems Governance and Financing at World Health Organization headquarters in Geneva. And I'm leading the development of the Handbook on Social Participation for UHC. We have with us online the handbook team, Katja Rohrer, who will be presenting today on capacities, on necessary capacities for meaningful government engagement with populations, communities, and civil society. Then my colleagues Kira Koch, Csongor Bajnowski, and Anna Socha. Just a few words on the handbook for those who haven't heard about it before, and just to give you a rough idea before we get into the presentation. The handbook project was basically born out of a recommendation of the WHO Civil Society Task Force on WHO's engagement with civil society in late 2018. And the development is guided by both an external and internal advisory group. Again, more details about this are in those initial webinars. But an important point that I would like to make before we start, and this is also relevant for the topic at hand today, is that our target audience is clearly policymakers, Ministry of Health mainly, but also other health institutions, so government more than anything. There was a lot of discussion within our external and internal advisory group about who the target audience should be for the handbook. And one of the reasons why we then narrowed down our target audience to policymakers was A, because there is a clear gap in guidance documentation for policymakers in this area of health governance, in this area of how to most effectively engage with populations, communities, and civil society. And secondly, there was a strong voice coming from civil society underlining the fact that there is quite a lot of materials by civil society for civil society, and there was a questioning of the place of WHO to be giving guidance to civil society, because that's not really in our mandate, in our role. What we can do is advise governments on how best to work with civil society, work with communities, work with populations, and also ensure adequate capacities for not only civil society and communities, but also for themselves as government. And as you will see in the course of this presentation, that is definitely one area where governments themselves are struggling quite a bit in terms of the how of participation. So with that brief introduction, I'll hand over to my colleague Kira, who will give you a brief outline of how the next hour is going to play out, and then we will hear the presentation from Katja. Thank you.
Thank you very much, Deepa, and also from my side, welcome to today's webinar. It's great to see a lot of familiar people in the attendees overview, so welcome to everyone who has already been part of our webinar series, and of course to all new people joining us today. My name is Kira Koch. I'm also part of the handbook team here at WHO headquarters, and I will just use the couple of minutes, as Deepa mentioned, to walk you through the overview of today's webinar. This webinar is hosted by the Health Systems Governance Collaborative, Health Systems Global, UHC 2030, the UHC 2030 Civil Society Engagement Mechanisms, also called CSEM, and the UHC Partnership. Katja Rohrer is our speaker today. She will give us a presentation, as you can see already on the slides, on necessary capacities for meaningful government engagement with populations, communities, and civil society, which will be followed by a Q&A session. For the Q&A session, I kindly request you to use the chat box. We will not be using audio or video for this presentation. And please make sure when you use the chat box to make sure that the to section of the chat box says to all panelists and attendees, so we can all see your questions. I will read out the questions later on and then group them if possible, and Katja will respond to the question. Please note that this presentation is being recorded, and we will share, as for all the other webinars, the recordings of the webinar on the Health Systems Governance Collaborative website, and I'm sharing the respective links in a few seconds in the chat box for your information. The same I will do for our past webinars. Just to recall, we had the first webinar on population engagement and decision making, the second one on representation and participatory processes, and the third one on legal frameworks for participation. And today, as said, it will be on capacities. For those of you who have not yet heard about, we also have a ongoing UHC 2030 consultation on the handbook currently up on the UHC 2030 website. And we invite all of you who are interested to fill out the survey. The survey is set up in English, but we invite you to respond in any language. We make sure that translations will be made possible. The consultation, for your information, is still up and will be open until the 10th of April 2020. So please use the last week or the last 10 days in order to make sure that your voice is getting heard. Thank you very much. With that, I will leave it to Katja. Katja, you have the floor for the presentation. Thank you.
Thank you very much, Kira. So my name is Katja Rohrer, and I will introduce the topic on necessary capacities for meaningful government engagement with populations, communities, and civil society. Next slide, please. So, well, what we have seen throughout the last webinar topics, and actually also through the comments that webinar participants made in the chat boxes, is that social participation requires all stakeholders in the participatory process to be able to adequately and fully exercise their roles. However, to do so and to engage in participation processes, all stakeholders should be on an equal footing with each other. So they need to be able to equally influence discussions, the debates, and basically all aspects that are related to the participation process. And therefore, this handbook chapter that I will introduce now focuses exactly on that topic. We're trying to elicit how to ensure the necessary capacities, both for civil society and for governments, to enable a level playing field for meaningful and systematic social participation. Through our research, we undertook case studies and we did literature reviews. We found that indeed governments do have a crucial role in ensuring that all stakeholders in the process are able to engage equally, or well, better, are able to engage on an equal footing. So this handbook's chapter's objectives is to discuss options how governments can A, better engage with people, communities, and civil society, and B, ensure that civil society actors are able or are enabled to actually provide their inputs in a constructive and meaningful way. We're not denying that civil society plays an important and decisive role in capacity building, especially in regard to social participation. However, as Deepa already mentioned in her opening, this handbook specifically targets governments, or let's say government actors, policymakers, so to say. So the emphasis for this chapter is to show what their role is and what their role should be to strengthen civil society capacities for social participation. So this presentation will first discuss what do we mean by capacity building, and we will introduce a typology of capacities. We will secondly introduce a set of social participation capacities, both for civil society and for governments, in line with this typology. And then thirdly, I would like to introduce some key challenges in regard to social participation capacities and capacity building and how to overcome them. Next slide, please. So when discussing a level playing field, it's important to consider why this level playing field might not have been achieved yet. And one maybe obvious reason is the existence of power imbalances between stakeholders. So in this scenario that we're talking about, it's in regard to power imbalances between civil society and government stakeholders to the participation process. So it's essential to consider how to diminish these power imbalances between stakeholders. And obviously there are multiple options to work on power imbalances. And we will discuss issues around power imbalances actually in more detail in a separate chapter. However, one option is definitely the empowerment of civil society stakeholders. So in regard to the handbook and the research we conducted for this handbook, we suggest to look at empowerment as a process of social action that creates in people, well, or in organizations, or in civil society institutions, or even in individuals and communities, a sense of confidence to take action towards collective goals. In that sense, we consider empowerment as a process that enables individuals and groups to influence decisions which affect themselves and to express their views, ideas, needs, concerns. And this process of empowerment, consequently, it challenges established political, social, and cultural norms because it challenges the existing power relations. And from this understanding of empowerment, we conceptualize capacity building for social participation as a process of empowerment because it allows individual and groups or organizations that are part of civil society to take action on their particular goals. And we actually undertook 9 case studies for this handbook, and we did literature reviews on different and varieties of topics, and 2 main components of empowerment crystallized through our research. There's managerial empowerment, which is broadly based on the idea to increase technical skills. And the second component is related to civic empowerment, which refers to capacities that are needed to overcome social inequalities. And one very important aspect that we elaborated through the case studies and the literature reviews is that governments have a double role in relation to both types of empowerment. They have a critical role in building or strengthening capacities that relate to both components, so managerial capacities as well as civic capacities for civil society. And at the same time, capacity building also needs to be targeted towards governments themselves, because they need to be able to recognize the need for civic and managerial empowerment for civil society actors, but they also need to recognize their own capacity gaps in relation to actively closing potential civil society capacity gaps. And based on all the primary data, well, which is our own case studies, and the secondary data, which is the literature reviews, we were able to identify 3 capacity dimensions that relate to the described empowerment components and that are essential for meaningful government engagement with civil society. So managerial empowerment relates to building or strengthening technical competencies, so, well, broadly speaking, technical skills. And civic empowerment relates to abilities that are related to overcoming social inequalities. And we were able to group the latter into 2 dimensions. There are abilities related to recognition and abilities related to communication. The divide between the 2 dimensions of ability is actually useful and important for the context of this handbook, because the former, so the abilities related to recognition, are basically a prerequisite for the latter, the abilities related to communication. Next slide, please. I will now briefly introduce these 3 dimensions and then give some examples of what type of skills and abilities we're referring to. So the first dimension relates to the technical skills for civil society, for social participation. And so capacity building activities in that regard aim to build technical skills in the sense of managerial empowerment, which basically means to increase the type of skills that are necessary to actively engage in participatory processes. So we refer to skills as a type of capacities that relates to a specific kind of knowledge or technical familiarity with a certain topic. The case studies and literature reviews demonstrate that specific skills support the interaction between governments and civil society, but at the same time, and that might be even more important, a lack of technical skills will negatively influence the type and quality of interaction between governments and civil society. And based on the evidence we gathered, we were able to identify the most prominent skills for meaningful and systematic social participation. And mirroring these skills for civil society, there is a relevant technical skill set for governments needed as well. Literature doesn't really tell us much about, in regard to the capacities needed for governments. However, the case studies that we conducted, they really showed a consistent picture, and that's why these elements are really important, because there is a need for government capacity strengthening in regard to technical skills to design and facilitate the process. So governments need to understand and be able to choose appropriate methods and tools for participation, so that they can be able to design a participation process that is appropriate for the type of actors, appropriate for the context, and appropriate for the content of the exercise. And then quickly on the capacity to actively increase the space for equitable civil society participation. So this aspect would involve building a trustful environment for all engaged stakeholders, and it relates to recognizing power relations and their impact on social participation. As I said, we will have a separate chapter on these aspects. And yes, one could argue that discussing the impact of power relations on social participation might be more related to aspects of civic empowerment, and we're not denying that. But there is a technical skill set that's needed for governments to be able to include different views and different voices in the participation process. For example, knowing how to convey messages to different types of groups, knowing how to set up communication strategies, and the similar. So for civic empowerment, we identified two capacity dimensions, and the first one being the abilities related to recognition. So this basically means that based on the data we analyzed for this handbook, we realized that for civil society actors, and again, this includes populations, communities, it includes even individuals, it's essential to recognize that participation in planning and policymaking processes is actually a possibility. And it is even a possibility that can be beneficial to their own goals. However, to understand and recognize this possibility is actually a fundamental capacity that needs to be strengthened, because it's so crucial for participation. Capacities are also needed on the government side to understand the added value of participation and ensure that participation literacy for equal engagement is increased in civil society. So in turn, governments who are actually willing to introduce social participation, they need to be able to recognize participation as essential to health planning and policymaking. And they also need to be willing to create equitable spaces for participation. And the third capacity dimension relates to abilities related to communication. So civil society need the capacity to interact and communicate with stakeholders of different origin and hierarchy, and especially with governments. So it's a crucial type of abilities, because it directly relates to the idea of civic empowerment. So these types of capacities are related to transforming perceived inequities into legitimate contributions to debates and discussions. For example, speaking in front of an audience or in an unfamiliar public is a key component of this capacity. We conducted a case study in Madagascar where we saw that community representatives took physically part in workshop, but sometimes they didn't feel adequate to speak up. We saw in our case study for the National Health Council in Portugal that members from civil society reported that they felt less secure to speak in front of a formal and also very hierarchical expert audience. So for governments, the capacity to communicate is just as relevant because it relates to government's abilities to find and use different communication channels to hear and understand different types and qualities of attempts by civil society actors to express their needs and enter into discussion with the government actors. Next slide, please. So since stakeholder capacity is such a determining factor for the success and also for the sustainability of a participatory process, we also need to consider the challenges and potential hindering factors for sorry, strengthening and using capacities. Based on our research, we were able to identify 4 most prominent types of challenges that I will now briefly introduce. The socioeconomic status can impede capacity building activities. So what do we mean by this? So first of all, we need to acknowledge that civic empowerment, or better, the lack of civic empowerment, is closely linked to a low socioeconomic status, which is a hindering factor for participation. And we identified 2 principal capacity building challenges based on low socioeconomic status. The inability to invest time or resources in participatory or capacity building activities. So the capacity to invest time and money and to accept the trade-offs that need to be accounted for are relative to the socioeconomic situation of the individual or the organization that is participating. And these costs can, for example, include transportation, childcare. It could be opportunity costs for not attending work. And these costs, they need to be covered somehow in order to enable individuals or organizations to participate in a specific process, in a specific event. And if these costs are not covered otherwise, then it's ultimately the participants themselves who have to bear these costs. And the second aspect is related to the socio-cultural hierarchies that impede on the use of capacities and capacity building. So to recognize your own ability and to be able to speak up is also determined by the socio-cultural paradigms of hierarchies and the norms that determine how to deal with these hierarchies. In the case study we conducted in Madagascar, we saw that people were afraid of negative repercussions through people that were a bit higher up in the system in case they would speak up. Another important challenge is related to the capacity building requirements. It requires sustainable funding because it's a long-term process. So building and strengthening capacities for social participation is very resource intense. So, however, sustainable and predictable funding would allow capacities to be built up slowly and sustainably over time. And many of the discussed governance and civil society capacities from the previous slide, which are needed for effective social participation, they're not developed through a one-off exercise, and they might actually take a bit of time. Capacity building needs to meet people's expectations. So ownership of capacity building activities or initiatives, even if the activities are promoted by the government, even if they're initiated by the government, even if they're conducted by the government, they should still be co-owned by those individuals or those communities or those organizations that are supposed to be benefiting from the training. So this actually requires capacity builders or capacity building organizers to be really sensitive to the level and type of change which is feasible and acceptable for the population. And lastly, we have to acknowledge that capacity building has limits. Capacities can be strengthened, but they can only be strengthened to a certain extent. And the political culture of the country itself has a very strong influence on the design and ideas of capacity building activities. Additionally, the prevailing political and social norms and paradigms and leadership approaches, they can strongly limit social participation. And similarly, the socioeconomic context of countries impedes on participation through hierarchies and other perceived barriers that impact on people's ability to engage in capacity building. And well, through our research, we found that acknowledging these limits and understanding how to deal with those limits, but at the same time challenging these limits is one of the great challenges of policymakers, or in that case, ministries of health, for capacity building for social participation. Next slide, please. And lastly, I would briefly like to discuss key issues in relation to these 3 capacity dimensions and how to overcome the challenges that we just discussed. So in regard to recognition, For both civil society and governments, the most fundamental capacity needed for participation on an equal level is the ability to recognize their own role in participation processes. The challenge is that, yes, capacity building in the dimension of recognition is of course very important and essential, but it's at the same time very difficult. And that is because this dimension of recognition is rooted in a basic, or is based on an understanding of the value of an individual to society. And it's rooted in a basic understanding of democratic principles. We are aware that with this handbook, we're mainly addressing health actors. And we're also aware that addressing these fundamental societal issues through the health sector alone would probably only have a narrow impact, if at all. But we saw in the research that we conducted for this handbook that health ministries and government actors can nevertheless ensure that they are aware of issues pertaining to recognition, and limit its effect on social participation in health. Another aspect is that capacity building for recognition basically aims at civic empowerment. So this also requires governments to recognize and understand their own role during the participation process. Political will and commitment by policymakers is needed to maintain capacities and keep capacity building as a topic or as a subject, especially during times of political change, for example. And policymakers themselves, they might need to be, or they will need to be taught to understand the necessity of engaging in social participation. And the literature reviews and the case studies we did, they point out that it's critical to increase the understanding and knowledge of government staff. It's not just about the highest political levels, where the theoretical or the political gains of supporting participation might even be easier, but it's also related to the mid-ranking technical staff who are actually the ones organizing and conducting participation exercises. For our case study in Burkina Faso, in an interview, a civil society representative stated that for social participation process, one person in a government system might actually be enough to block the entire process. In relation to communication, so the success of social participation processes heavily depends on civil society's ability to communicate, meaning their ability to formulate arguments and to influence public debate. Consequently, social participation also depends on government's ability to actively increase the space for participation, to give populations, civil societies, and communities the opportunity to communicate. And some aspects of communication, for example, formulating arguments, negotiating, this can be learned through training, but those training efforts are more effective when the socioeconomic barriers, what we've discussed earlier in relation to, for example, communicating with hierarchies, relates back to recognition, and that this is recognized by those organizing the capacity building, and it's actually taken into account by them. So ideally, this would include any of these measures to address those barriers, but it could at least be considered during the design or when designing capacity building exercises. Governments need capacities as well, and it's not only to hear messages that are maybe formulated in a colloquial style, but they need to be able to distill what is relevant for policy, but they also need to be able to convey messages in a simpler language to different audiences, maybe through participatory platforms, in order to steer the discussion and to steer the debate towards feasible policy options. And government capacity to simplify technical nuances and perceive technical issues from the population, and well, from a specific perspective, from lay persons' perspective, is important in preparing background information for the participatory process. So we understand that simplifying complex issues while still keeping a relevant nuance is not an easy task, and that's why it's part of this capacity dimension. There is an additional emphasis that we have to put, is to ensure that the most vulnerable population groups, so those who tend to have the most difficulties in understanding technical details, are sought out and given additional support for technical capacity building. And in relation to technical skills, so the literature and case studies, they affirm that technical knowledge and an understanding of the topic at stake are essential for the ability to participate. Technical skills to understand the topic, to form an opinion, to make an informed choice on how to participate, all of this influences the quality of the participation process. Sorry. And it influences ultimately the ability for civil society to engage with governments on a level playing field, or as much on a level playing field as possible. But also, and this is what we mainly found through our case studies, a lack of skills in civil society, for example, a lack of language knowledge, a lack of technical expertise, needs to be recognized by government actors, and capacity building processes need to be targeted towards increasing technical skills. It's also important to note that capacity building happens during the very process of participation itself. So room needs to be given within the participation process for a learning by doing approach, which of course can be accompanied by targeted capacity building initiatives. Next slide, please. And this last slide is to just show again that the three capacity dimensions are related to each other. And how are they related to each other? And especially in regard to civic empowerment, where capacities related to recognition are a prerequisite of capacities related to communication. So governments need to support civil society actors in understanding that they can play a role in planning and policy making, which is recognition, using that role effectively, which is communication, and they need to support civil society actors in improving their technical knowledge that is needed to fully engage in discussions pertaining to the process at hand. Sorry, so this would be technical skills. Well, what we've seen from the discussion of the capacity dimensions from the last slides, due to the handbook's target audience of policymakers, the types of activities these capacities and empowerment processes relate to are mostly in regard to policy activities. So, for example, representing interests, holding policymakers to account, challenging decisions, advocating for policies. And just lastly, as a summary or a conclusion, so the three dimensions of capacities as introduced in this presentation and as part of the handbook chapter are conceptually relevant when designing capacity building activities because they mutually depend on each other. And even though recognition was labeled as the most fundamental dimension of capacities, we also have to acknowledge that it's the most difficult to build because it's strongly linked to socio-cultural conditions of society that cannot be influenced by the health sector alone. Communication, as a second fundamental dimension of capacities, is based on recognition, but relies to a great extent on the ability of governments to create spaces for participation and to enable trustful communication between stakeholders. The third fundamental constraint for participation was the potential lack of technical skills of civil society actors, because technical skills were identified as essential for creating a strong vision and clear targets for engagement and for articulating these targets. So thank you very much, and I would now hand back over to Kira.
Thank you very much, Katja, for this presentation, and thank you already for those of you who have put in your questions in the chat box. Just a quick reminder, please make sure that the to section indicates to all panelists and attendees so we all can see your questions. Thank you very much, Katja. I will start with the Q&A session, and I will start maybe with a clarification question first, which has arrived us from Nagi Salama, who would like to know, and maybe I know that you have already talked about limits about capacity building. What are the most common limits facing capacity building? Maybe you can elaborate a little bit more on that point. Thank you.
The most common limits on capacity building. Well, I mean, I've discussed about this in regard to the challenges, and those that we mentioned are actually the ones that we were able to identify through the literature reviews and the case studies. We undertook 9 case studies for this handbook in different parts of the world with a different topic in mind. We had different engagement modalities that we looked in this case study. So we really had a broad variety of case studies. And those challenges that I mentioned, those were actually the ones that seemed to be the most prominent. We also validated this with the literature reviews that we undertook. And we can be really certain that those 4 challenges that we identified are the most prominent. I can briefly repeat it. So it's the socioeconomic status of the participants or the potential participants that should participate to the process. It's the funding issues in relation to the idea that capacity building should be a long-term process. The third issue was in relation that the needs of the people that the capacities should be built for should actually meet those needs. And the last one was the limit of capacity building as discussed in relation to that the target group of this handbook is sort of policymakers. In relation, we're addressing more or less the Ministry of Health. We're talking about social participation for universal health coverage, and one of the limits is that we cannot go beyond that. There are hierarchies, there are barriers in societies, there are power hierarchies, there are power asymmetries that impede on full social participation, and we have to acknowledge these limits. We cannot go much further than the remits of, in this case, the Ministries of Health, for example.
Thank you very much, Katja. Another question that has arrived us from Alison Keeley is talking about a topic that we have mentioned now in all of our series, which is about power relations, legitimacy. So her question is, what were your findings on the impact of having a neutral, legitimate broker design and facilitate such engagement between government and civil society, rather than government playing that role, which of course has an influence on power dynamics? And can the participants really co-own the process?
I mean, this chapter focuses on the capacity aspects of participation. And if I understand the question correctly, the question is if there would be an institution or a neutral party to the capacity building aspects of social participation. Yes, I mean, in the literature reviews that we did, and actually in discussions that we had with our external advisory group, this issue came up, and it's of course a very well. I mean, it's a mechanism that can be used, and that, if supported from both sides, can of course be used. There's nothing impeding on this. The only thing is that it's important that, because we're talking about the power relations, and that the needs of the civil society in regard to the capacity building actually meets or matches the capacity building offers that the government puts in. So even though there's a neutral party to this, there needs to be some sort of engagement of both sides, definitely.
Hi, this is Deepa, and just to add to what Katja just said, that model was partly used in Tunisia in the first phase of the Societal Dialogue for Health, where an outside institution was brought in to support both the ministry and the Societal Dialogue of Health to build capacity, and not only of civil society, in fact, also to support the Societal Dialogue for Health initiative and the ministry on how to design these spaces and ensure that the capacity is there on all sides to engage with each other. And so there are many examples of that model of an independent institutions undertaking that. And to be fair, a lot of governments don't have that capacity themselves and need to reach out to experts or those who already have some practice, some experience with social participation mechanisms. Over.
Thank you very much, Deepa and Katja. We have another question from Hala coming in. She talks about civic empowerment requires supportive mechanisms and regulatory frameworks. Cultural change and transformation is nourished through transparency and sharing information. Building mutual trust, and maybe a quick reflection on how to operationalize this in countries. And maybe you can reflect a little bit on our case studies that we have done for the handbook. Thank you.
Yeah, I mean the big the difficulty with civic empowerment is that it basically touches all questions around the society. So it's not just about having one little training, it's really about understanding what a person value has to a society and what society should be, how a society could look like. So civic empowerment really is an all-encompassing process, and therefore it's nothing that can be done by the health sector alone. It usually comes with a for example, through a democratization process. We've seen that a lot, that in cases where democratization processes were undergoing, that also civil rights and civil rights movements took on, and that's one aspect of civic empowerment, obviously. I'm sorry, was that the question?
Yes, thank you very much, Katja. I think it touches about a lot of aspects that we have also discussed during the whole webinar series, because it's also, of course, related to this enabling environment and factors that are favoring participatory or an inclusive and meaningful participatory process. Let me maybe jump to the next question, because now we actually received quite a bit of questions coming into the chat box. So thank you for that. Katja, I have another question which comes from Camilla Bergen. She asks, what is the will from governments in low income, middle income and high income countries to engage in the process of capacity building in order to empower civil society? And have you seen any differences between richer and poorer countries in this regard?
I'm not sure if I understand the question correctly, but yes, I mean, there is a difference between high income and low income country, and that's the possibility of governments to support, to have this sustainable and long-term commitment, which relates to financial aspects. There is a difference in that. And I'm not sure if I understood the question correctly, but governments, they have this role. In some countries, this role isn't taken on by governments. So that's why this handbook is sort of, we're not trying to be normative per se, but we're trying to show what options could governments use, or what aspects could governments look into more in case they would be willing to engage with civil society on an equal level, or on a level playing field. And that's why we looked into these 3 capacity dimensions, because they show that governments should not just consider one specific aspect of capacity building, but they should always consider that capacity building is part of a spectrum of capacities, and that for example, building technical skills in a community for participation needs to require, or needs to be built on capacities that are based on recognition, so that governments are able to understand what is actually needed in a society, that they themselves increase their own capacities in assessing the potential capacity gaps in societies. And that's sort of the idea of the chapter and of the handbook.
Thank you very much, Katja, and I think you're completely right. I think what we would also like to do with this handbook is, of course, to make that case that it's important in order to invest in capacity building on both sides for government as well as for population, community and civil society groups, in order to then inform the whole policy process on that critical piece of information that is so often missing, to draft some more of those policies which are more responsive to the needs of the population. I'm moving on to another question, Katja, on Hizam.
I think Deepa would like to come in.
Yes, please go ahead, Deepa, if you have something to complement.
Yeah, I mean, just very, very briefly, I mean, you both have said it all, but just to say that on the issue of high, middle, and low-income country, I think more than anything, it's about political will more than financial capacity, because these, you know, what capacity building takes in resources and costs compared to what you would be spending in the health sector otherwise is not huge. And countries like Thailand have really led the way, where they started putting money into capacity building for civil society before they became, you know, a strong middle income country. So it's a lot of it is about political will. What Thailand did was use the 2% sin tax on alcohol to fund the Thai Health Promotion Foundation, which then gives core contribution to civil society and allows civil society to operate. And other countries, of course, in France, our interviews there in our French case study definitely showed that civil society organizations took very much advantage of the tax breaks in the French system that allowed them to have the sufficient funding to operate over the long term. So it is a financial issue, but I think more than anything, it's the political will behind it, whether high, low, or middle income country.
Thanks very much, Deepa, for this addition, which I think is very, very pertinent as well, that it's not only on the financial side, but it's, as you mentioned, on the capacity and the political will more than ever. I would like to go to another question from Hizam. He asks on how a country can use its local and community-based capabilities, in brackets, or in terms of religious, cultural, and other current potentials, to facilitate the empowerment in both civic and managerial dimensions.
In relation, okay, I hope I understood the question correctly. So, well, all three dimensions are really relevant, and the target group of the handbook is the policymakers. So we're looking at the angle: how can policymakers create an enabling environment for social participation for civil society to participate meaningfully and sustainably. And one aspect of this is ensure that the capacities in civil society are there. As Deepa mentioned in the beginning, we're not so much looking, this is not supposed to be a guiding document for civil society per se. And she mentioned the two reasons why this wouldn't be the case. So from the perspective of this target group and the handbook, we would look into the options that governments have to increase capacity building in the society. And of course, I mean, governments, and that relates back to the session we had on representativeness. It's important for governments to understand who is at the table, why are some groups maybe not at the table, and how can this be changed? And that relates back to these community groups that you just mentioned, Kira, that there are different groups in a community. And the question is, how can they be included as much as possible, which is relates maybe more back to representation, but then also how can their capacities be strengthened so that when they arrive at the table, they are able to participate fully and truly.
Thank you very much, Katja. And I think this also goes in hand with what we sometimes call that civil society can be that middle man or middle woman between government and those local community grassroots organization and also population groups, right? That has been pointed out here in order to make that link and the bridge, and then of course through capacity building even enforce it more. I would like to go back to another question from Shamila Sousa, who is asking on our literature review and our case studies if we found anything with regards to citizen science. She's reflecting on there's an entire field of knowledge called social studies of science and technology that is dedicated to studying how and why and by whom we do those things. So maybe a quick reflection if you have come across the science, citizen science field, which, if I can see this question here correctly, goes very much about co-production, co-creation of citizen science experiences.
Yeah, I mean, the literature reviews, they were, yeah, we looked into different topics. We looked into some topics that are more related to theory, some that are more, for example, other case studies prepared in the literature. So we looked into different directions, and we tried to synthesize something that's practical, that's applicable, and that's not too theoretical. So we try to distill the main messages. Our starting point were sort of the case studies. We try to, based on the case studies and yeah, and the discussions we had with our external and internal advisory group, we then try to distill these different topics, and those topics that we've seen over the past couple of webinars and that are part of the handbook chapters, they show us how to navigate this issue around social participation. And some issues, for example, this, what you just mentioned, the citizens aspects, we tried to look into the area of empowerment and see it through this lens, because this was the way that we were able to validate our findings from the case studies and to see how capacity building is actually part of empowerment. So this is, so these aspects that you just mentioned, they're part of it. We're just not as specific on it. Yeah, but they're a part of it.
Thank you very much, Katja. Another question from Nagil Salama, who is asking, should a legitimate neutral party in the capacity building process be an external one? And I think that's again that discussion on internal, external, and who should be doing capacity building initiatives.
Yeah, I mean, I think that relates back to the question of what is legitimate. And that might actually be more a question to the discussion in representation. I would assume, if I understand the question correctly, Kira, maybe Deepa wants to come in on the question on legitimacy.
Yeah, sure. Yeah, thanks for that question. And we did discuss this in length actually 2 webinars ago on when we discussed representation. And I think you know, the premise that we are taking in this handbook, or from the start, and the whole framing that we're taking, is that, you know, what participation is about in the end is being able to put those who participate who would normally not participate or be involved in decision making at a sort of eye-to-eye level with those who are already in the decision making process and have their legitimacy inherently. So from seeing that way, you know, government obviously have their legitimacy through their government position. Experts, health professionals often have their legitimacy just based on their expertise and their knowledge. But where the legitimacy is a big question and is often put in question is on the side of communities, populations, and civil society, you know, to be involved in these decision-making processes. And sometimes that legitimacy may be a given because they are widely perceived to have a certain expertise. Some civil society organizations have a specific expertise in an area that's established, they have a good reputation for. Other organizations have a huge community behind them, so they have the numbers that is widely perceived to be the case and accepted, like unions, for example, trade unions, or big community organization, and that gives them that legitimacy. But many, are less known, less vocal, maybe have less capacities, and so their legitimacy is put into question. And in order to lend that legitimacy, there are many ways to do so. And from a government perspective, one way is through the format and design of a process to ensure that it gives everyone the same type of information and allows the factual information to reach those who may not have access to it, vis-a-vis health professionals and government, for example. There are many other ways through format and design during the process or event itself, with seating arrangements, with allowing speaking time to be higher for those who speak up less, for example. And there are many other ways as well. Sometimes it might mean going specifically to certain groups, to their place of work or place of residence, to get their input without the intimidating presence of others that might not allow them to speak up so much. So these are ways to legitimize their views. And so legitimacy is partly about how the format and design of the participatory process is, and it's also partly about how the selection process takes place, how transparent it is, how the roles are transparent and clear to everyone, so that if everyone's role around the table is clear and transparent, they all have a legitimate say and place at that table. And the whole thing of legitimacy in the end is about, legitimacy is a source of power. It's about leveling that playing field and ensuring that everyone has their source of legitimacy and source of power when they sit around the table within a decision-making space to equally, as far as possible, influence decisions.
Thank you very much, Deepa and Katja. Another question which I think very much links to that is from Franco Mastera. He's asking if we suggest particular aspects to take into consideration in order to make social participation more inclusive for marginalized population groups, for example, disability, people with disabilities, etc. And I think maybe, Katja, if you want to start, but I already see that there is quite an overlap what we also discussed in the representation webinar on process and design elements and which mechanisms we would like to choose. So I leave it to Katja and maybe Deepa to complement on this question. Thank you.
Well, I would actually hand over to Deepa, because this is sort of the core element of representation, no?
Sure. Deepa, would you come in?
Yes, sorry, can you repeat the last part of the question?
So the question was on potential ways in order to take into consideration to make processes more inclusive for marginalized groups, for example, people with disabilities.
Right. Yeah. Okay. Okay, so thanks. I thought there was more to that question. So, okay, for marginalized groups, so this, and I think this is something we've repeated in every single one of our webinars. And the data that we analyze is quite loud and clear on this, is that marginalized groups definitely always still get left behind in almost all of the participatory processes that we studied, even the most sophisticated ones, like the National Health Assembly in Thailand, and it's not always due to bad intention. Sometimes it is. We have to acknowledge that as well. Sometimes it is a specific government policy, but often it's because governments themselves struggle with the how of participatory processes, don't know how to do it adequately, don't know how to address representation issues, and are unaware of the marginalization at times that takes place in society, because most governments and those in power do come from majority groups or from the privileged 10% of society. So it's not always ill will, but what we have seen is that even in the best designed participatory processes, unfortunately, marginalized groups do get left behind. And the one way to really address that issue is that, and this is the recommendation, strong recommendation we're making in the handbook, is that along every step of the process of putting together and designing a participatory space and designing and conducting each of the various events within a participatory process, that question needs to be asked: who is not at the table? And by analyzing at each step of the way who is not at the table, we will then try to adapt and put together perhaps a mechanism or an approach that is adapted to that group who's not at the table, and find ways to reach out to them. And this I've mentioned before in other webinars as well. And you know, when WHO had the privilege to support the Societal Dialogue for Health process in Tunisia, for example, and in their phase 1, it was quite clear after a series of public hearings that were done and citizen jury mechanisms. There were various methodologies that were used. What we did realize was that women were not speaking up as much as, as much as others, that there were certain groups that were not participating at all. So what the Societal Dialogue for Health Secretariat did was organize specific focus groups, focused targeting those groups that were not participating. So an initial analysis was done to see who was not participating, and then a specific homogeneous focus group was conducted for those groups only. The point being is that they would feel more comfortable speaking amongst each other without other types of groups and people in the room. And so they were A, homogeneous, and B, they were in their communities. So the team went to the communities to conduct those homogeneous focus groups to get those views. So that's one way of doing it. Another way of doing it is, again, is the location is to not have the meetings in capital spaces, capital city, fancy hotels, which might be intimidating for some groups, and especially marginalized groups. And then, of course, a third pillar, which is very important in reaching out to marginalized groups, is to target capacity building activities to those groups, because those are usually the ones that need it most.
Thank you very much. And maybe a very practical question that has come in from Isubalev. Based on the results that we have on the literature review and case studies, to what extent does the handbook, as it is not yet finished, go in providing practical steps needed to build the necessary capacities?
Well, I mean, that's the good thing of the handbook is that we undertook 9 case studies. So we try to show examples of how in other settings, in other countries, for different participation processes, things were done. So we really try to show, maybe the term best practices is not good, but we try to show lessons learned. And these lessons learned are hopefully as practical as possible. Yeah.
Yes, and just to add to that, thanks, Katja, is, some examples are, of course, Thailand is maybe our stellar example with, 2% of alcohol sin tax going to the Thai health promotion funds. But what that does, it gives core funding to civil society. And the National Health Commission Office, which is the government health institution that's independent of the Ministry of Health, that leads and conducts the National Health Assembly every year. They spend most of their time doing capacity building activities all over the country, and much of their capacity building is activities are around the recognition piece. So to make people aware that this mechanism, the National Health Assembly, even exists for them to take part, and for them to understand how this could be helpful for their own goals. So they go into communities and try to make people aware of the NHA, the National Health Assembly. They also work with some of the more outlying provinces to help build capacity in building networks of civil societies within those provinces to work with each other and collaborate more. And because alliance building amongst civil society makes the case stronger for any particular issue that might be relevant for that province. They also work with some of the higher capacity provinces in sort of a South-South cooperation, sort of a domestic South-South cooperation model, where the higher capacity provinces provide a sort of mentoring for the lower capacity provinces in these civil society networks, in order to strengthen them. other models that we do see is, for example, as I mentioned in Tunisia, some bringing in outside experts to build capacity, to moderate, to facilitate some of these events, since moderation and facilitation is a key issue during the event itself, to iron out power imbalances in at the moment on the spot. So there are many ways some of these capacity building activities can happen, and I think the important thing is to start with the recognition at government level, which would be sort of our main target audience, especially as WHO, um, to, to, to do a sort of self-analysis of what are the capacities needed internally in order to do participation, in order to organize these participatory spaces, and then and then start reaching out to the relevant actors, starting with WHO, because we, there's a lot of capacity building work that we do ourselves, mainly for government actors, and then start working with the various communities and civil society organizations. And then finally, I'd like to say one of the best capacity building activities is actually just to have that participatory space available, because it's a learning by doing approach. What we see across many of the countries that we studied is that by the very virtue of having a space available for people to come together of differing views and differing backgrounds and discuss and exchange with each other, gives that allows people to practice that participation and improve at it. It gives them the space to understand what kind of skills are needed to be built for the next event. And that was a key factor in Thailand. The National Health Assembly has been around for 20 years unofficially and 10 years in a more formalized format. And many of the civil society actors that we spoke with, and also government actors, by the way, were very clear in saying that, it helps, that just by taking part every year, it helped them to build their own capacities to know how best to make that argument, which people to target, which way to package the information, etc. So one of the best ways to do it is to just start, and even an imperfect participatory space is better than anything to start with hopefully a long-term sort of goal of improving it over time.
Thank you very much, both of you. In the interest of time, I know that we have completed now 1 hour of the webinar. However, I can see 2 more questions here on my list. So I would like to run a little bit over time in order to take those 2 questions. And I would like Deepa and Katja to answer those as precise as possible, if possible, of course. So the first question is coming from Jaime Jimenez. He is asking on measurements for social participation, and particularly if we have found in our literature review better measures than social or socioeconomic status to identify challenges. For example, level of participation in associations or movements in a country, internet penetration and use, etc. Maybe a quick reflection on this one. Thank you.
Maybe just quickly from my side. Well, socioeconomic status, we're not using it as a measurement for participation. We're using it as a measurement, we're using it to say what impedes, what hinders social participation. So we're not really using it to show, I mean, I know what you mean by this question, but we're trying just to say that socioeconomic status reflects on power asymmetries in societies. And this chapter on capacities is aiming to look into how can we level out these power imbalances or these power asymmetries. So socioeconomic status is not so much a measure for us for social participation. It's just one element on the process that we have to consider.
Maybe a follow-up question, because the question was more on other measures than socioeconomic status. Can you reflect on other than socioeconomic?
Yes, maybe I can jump in here. On participation, so this handbook doesn't particularly focus on measurement at all, because we're looking more at the how and the process of participation. However, in another sort of stream of work, that we work on, we have looked into, what is the status quo of measurement of participation out there. And I think, to make quite a long story short, is that there's no common definition of participation to start with, and of course on the quantitative side there's really no real measure of participation that's widely used. On the qualitative side, there's a few there are a few questions, that are qualitative questions that can be answered, that can be used as measures, but there's nothing, there's no common set of questions that people use. There are different tools developed, but all with a very particular angle taken, depending on what the participation is for. So there's nothing common out there. And what would, what we would definitely say here is that it's difficult to really get an adequate sense of meaningful participation through quantitative measures only, although they're better than nothing. So even for our global program of work, WHO Global Program of Work monitoring, we do have one indicator where which we monitor in the 194 member states, on how far the process of national health policy, national health planning and national health plan development in countries is participatory. Now, this is a simple yes/no answer, and and each country, most countries answer yes, but what that means behind it is, of course, very different, because it might mean yes because you've invited a couple of civil society organizations, whether they attended or not, or it might mean that a yes because in in Thailand they actually had a whole process of a national health assembly behind it. So the two answers would be yes, but behind it you have a very different participation. So I think the message that I guess I would like to make is that, in essence, if you really want to get a true sense of how participation happens, and if you really want to measure it, we'd have to go into the qualitative sphere. And ideally, and this is something that we are thinking of moving into over time, to develop something like this, is once we've got a good sense of what those qualitative questions are and have fine-tuned them through country pilots and indicator validations, is to then move to a scoring system for each of these qualitative questions, which then brings us to the quantitative and allows us to then measure or compare countries or compare regions within countries. But what's out there at the moment is definitely not anywhere near that sort of goal, which is far away from us still at the moment.
Thank you very much. And then the last question that came in from the Jeffrey, it's actually two questions, but maybe we can have a combined answer. The first one is on the role for government health organization to acknowledge more data, which proactively facilitates productive dialogue about risk tolerances. And here we are talking about tobacco, alcohol use, etc., in order to facilitate more of a dialogue in society and in the government. And the second question is related to that. What about a requirement for governments to publish online comments and criticisms of regulatory and budgetary consultations, since, as that's what we have also stressed, transparency is a key dimension or a key important ingredient for social participation. Maybe a quick, concise comments from both of you. Thank you.
Okay, maybe I can just start. I mean, I think definitely more data, more information is material for dialogue. Definitely. I mean, we see in our data that evidence is a key facilitator for policy dialogue, and the more that we have and the more that is made available and transparent, the more you have people who have opinions on it and views on it and who maybe cross-analyze it, and so you can have a really rich discussion. This does require a certain level of transparency, and this is also, in terms of capacity building, it's key, because it means that that information that may be privy to the eyes of government or certain experts only needs to be processed in a format that is made available to populations, to communities, to civil society. And again, I come back to Thailand. They're quite good about doing infographics and short videos to convey some of the messages coming out of the evidence to those who cannot read, for example. And so that's that communication ability. But at its core, it's about having the data in the first place and being transparent about it. So definitely agree on that. In terms of online criticisms or feedback, and I think here it's, the key thing here is we're talking about the feedback loop. When you have a participatory space and a process, one of the complaints that we often hear from civil society and population groups is that they give their input and then you don't hear what happens afterwards. There's no feedback as to how far their input has been taken up or not, or what, there might be a huge gap between that decision-making consultation space and an actual policy or law revision, or it might not be that direct link anyway, so you don't really know what happens. And I think here the feedback loop is really key, is for organizers of participatory spaces to feed back to those who have taken part, and at least update regularly what has happened to that input, what's the process, what is what is envisaged, and in certain cases specifically address certain key criticisms or comments, especially if it's coming with a strong voice and particularly affects a large community, for example. And in terms of, one of the chapters that we have in this handbook is on sustaining participatory efforts and participation and motivation for participation over time. And one of the key ways to do that in countries that have a lot of experience with participatory processes, one of what civil society clearly says is that they're motivated to stay participating if they keep getting feedback, if they see where their input is going and that it's not going anywhere. Over.
Thank you very much. And thank you very much for both of you, Katja and Deepa, for this very rich question and answer session. I know we have run over time, but I think it was, it was worth in order to reflect on all the questions that came in. Thank you very much to everyone who joined us today or who has also joined us in the previous webinars. I think it was a very enriching webinar series on the Handbook on Social Participation for UHC. And I would just like to hand over to Deepa again to close this webinar series. And maybe just as a little note, if you have not yet done it, please go to the UHC 2030 website and fill out the survey for us to take into consideration your inputs on the Handbook on Social Participation. Thank you very much from my side, and please stay safe and healthy. Thank you.
Yes, and thanks again to everyone. This is again the last of our 4 webinars, and we will be continuing to finish drafting our chapters. We're almost there. As Kira just said, the gist of the chapters are already up on the UHC 2030 websites for your input and comments. We hope to launch this book in the next few months. Our timetables and timelines have been turned a bit topsy-turvy at the moment with the COVID crisis, but in any case, we will definitely still continue working on this despite other COVID-related work being thrown our way, and hope to launch the handbook very soon, and we'll keep you all posted there. So we're looking at a couple of months' time until we launch the handbook, and we hope that you and many others will help us disseminate it. Thank you very much, and stay safe.